There's 4 kinds of therapies that we've found to be really effective. The first one that we've been using since 1972, the most effective therapy that we found is holding therapy. And it's a safe place to release big feelings. Now, holding therapy takes about 1 month for every year of age that the child is, unless they've had drugs or alcohol before they're born. Then it's so variable that we have no idea how long it's going to take. But it's an exhausting therapy for the therapist, for the parent, for the child. It's a lot of hard work. It's hours of work. We added to that mix Neurofeedback, which is a computer game they play with their brain waves. Okay, it doesn't brainwash them. It doesn't feed anything into their brain, but it exercises their brain to work appropriately so that they can think more clearly. When we added that to the mix, it cut out half of the amount of holding therapy that they needed to have. So we're pretty excited about that. Then we added EMDR, which is eye movement, desensitization, and reprocessing. And that cut out another 1/4 of the amount of time they needed to have the holding therapy. And that's a very unusual therapy that was developed for post-traumatic stress disorder. I can't explain it really well, but I'll give it my best shot. We have memories of, maybe a car accident we were in or some trauma. And when we remember it, our heart pounds and our breathing changes as our body relives the trauma we lived through. Children who have post-traumatic stress disorder, and most of our children with attachment disorder have post-traumatic stress disorder. That's how they got the attachment disorder, okay? They have these flashbacks throughout the night, throughout the day, and they don't realize we aren't all going around like that. But they have flashbacks of the trauma, and their heart rate changes, and their breathing changes, and their whole body tenses up continuously throughout the day, sometimes 15, 20 times a day, and then again throughout the night. So EMDR, they still have their memory. There's no brainwashing going on, okay? Their brains need cleaned up, but that's not what we do, okay? So they still have the memory, but this therapy separates the emotional charge from the memory. So they can remember it when they want to, but they don't remember it with the same heart-pounding terror that they do before the therapy. And we just have the therapist do a few sessions of EMDR. It's not years of EMDR or, 50 sessions or anything, to take care of the trauma that the child has gone through. Another therapy that we found very helpful with the younger children is TheraPlay. And it's games that the therapist teaches the mother to do with the child. The mom and the dad do with the child, such as the mom says, "Okay, sweetums, I want you to go and sit on the chair." And then when the child sits on the chair, the mom blows bubbles. They say, "Okay, now hop up and pop the bubbles." Oh, yay! And they're popping the bubbles and laughing together. And then mom says, "Okay, run and sit on the chair." And mom doesn't blow bubbles till the child sits on the chair. And then mom blows bubbles. "Okay, hop up and pop." So it's a lot of control as well as a lot of joy and laughter. Now, if the therapist does this with the child, it's not helpful to the bonding, because the child would rather play with the therapist than the mother, because the mom's the one that they have the problem with. So the therapist teaches the mom and the dad how to do the games. And you can see why this would not work with a teenager. That's it, pop your own bubbles, So with the younger children, the TheraPlay is very helpful.